Welcome to the first ever remote Living for Zachary physician panel, an interview on COVID-19, youth, and heart health. My name is Bud Smith and I'm with Zoll Medical, and we're the acting sponsor. The coronavirus has clearly taken over all of our lives in 2020 and 2021, and the effects on our health today and beyond are really quite unknown. The recommendations post-diagnosis are continuing to be debated, which makes this physician panel very educational. One thing which has not been debated is Zoll Medical's love for Zachary. Zoll has been a part of L4Z since 2013, and we are extremely happy to be the sponsor of this particular event. This charity's work around screening, creating a database for research, and placing AEDs in venues all across DFW continue to be the reason Zoll remains heavily involved. Since the charity's inception in 2009, over 8,000 screenings have been conducted, more than 300 AEDs have been donated, and close to 2,000 people in DFW have been trained on life support. L4Z founder and president Karen Schra leaves no stone unturned and fights furiously to make Living for Zachary a well-known name. She dedicates her heart to this initiative, no doubt, and the more love and hard work by others always seem to flourish. Zoll Medical and Living for Zachary welcome you, but more importantly, want you to be a part of something special. Please consider giving to L4Z any way you can in 2021. And with that, please enjoy an interview on COVID-19, youth, and heart health.
Dr. Laird, Dr. Rauscher, thank you for joining us for our first ever virtual physician panel. I'm very excited to be here with you to share this important information with our Living for Zachary family, which I know right now is very topical and something that I think a lot of people are wondering about in 2020 and 2021 now. So before we jump in, I wanted to give you each a chance to introduce yourself briefly. So Dr. Laird, I will start with you.
Yeah, my name's Penn Laird. I'm a pediatric cardiologist. I work at Pediatric Heart Specialists, and we're affiliated with Children's Health. I've been in practice for just about 20 years now, and I've been involved with the Living for Zachary Foundation for pretty much the entire lifespan of it. So,
thank you. Dr. Rauscher?
Great. I'm David Rauscher. I'm a cardiologist. I'm actually an adult cardiologist, and I have a large heart failure practice, and I'm affiliated with the Heart Hospital Baylor Plano. I did all my training up at the University of Chicago, but I also have been down here for about 20 years, so I claim Texas is home.
Fantastic. Well, we will jump right in. So we all know that the big talking point of last year and this year has been COVID. And I think something that a lot of families in North Texas are probably wondering is long-term effects of COVID and how that might impact the heart. I know we've all seen some interesting news articles that have come out. So I want to start with you, Dr. Rauscher. Can you tell us what we know so far about COVID's impact on the heart?
Yeah, I mean, COVID really has been a tremendous impact on our practice and really on society, and it does affect the heart. We definitely have seen an uptick in a lot of different cardiovascular issues. COVID doesn't primarily affect the heart in most cases, but it can. And it can affect the heart in several ways. One of the more common and more prevalent things that I see, especially in adult patients, is it causes just sort of a general inflammation around the heart. The patients just have sort of a lingering chest discomfort and a sensation of chest fullness for several weeks after they've recovered from COVID. In the most severe cases, the COVID virus directly affects the heart, and there can be an infection and inflammation of the heart tissues called myocarditis. And we worry a lot about those kind of things when it does affect the heart. It can weaken the heart, and it can cause some fluid to build up around the outside of the heart in those cases.
Okay. And Dr. Laird, as a pediatric cardiologist, what are you seeing in your practice?
So we are a lot of young people that have had COVID-19 that are coming in following an infection for screening. A lot of young athletes as well, and Fortunately, the vast majority of young people have had relatively mild infections. And by mild, I mean symptoms like fever for, at most a few days, potentially other symptoms like congestion, sore throat, and cough. Some of them have lingering symptoms of, fatigue and shortness of breath. A very small percentage of these may complain of potentially heart-related symptoms like chest pain or palpitations, et cetera. But, most of these young people that we're seeing have, they've had relatively mild infections. They've made a full recovery and they're feeling fine. Fortunately, the vast majority that we've screened have had completely normal cardiac evaluations. Definitely is a smaller subset of patients that are having long-term effects. And these are kids that have had COVID 2 to 3 months ago, but they're still experiencing symptoms of fatigue and shortness of breath. Fortunately, most of these kids have normal cardiac evaluations as well, but, clearly there is the possibility for long-term side effects from COVID. But it looks like in young people, at least, most of these longer-term side effects appear to be respiratory related.
Okay, very interesting. And for both of you, have you noticed that there's a specific age range that this seems to be impacting more frequently, these long-term side effects?
I think probably it's a spectrum, so that the younger patients have a lot less risk for having cardiovascular side effects and almost always have a milder course of disease. And then the older patients are, the more risk they have for having severe illness. And partly that risk is borne out in the sort of vaccine strategy. We know that the older the patients are, the more likely they are to have severe side effects, and then we try to prioritize them to get the vaccine. But at the same time, it's also patients with pre-existing cardiovascular and other illnesses, so that you sort of have less reserve, because even if the COVID virus doesn't directly affect the heart, if it makes you sick and your heart can't sort of support you during that time that you're ill, then you can have really much more profound illness with the COVID infection. So I think that the older the person is, the more risk factors they have, and certainly the more comorbidities or other illnesses that patients have, the more risk they are for having severe outcomes.
Sure. What don't we know about COVID and the heart at this point? I know we're still early on in this journey. What is it that we're still kind of waiting to see?
From my perspective, it's really the long-term side effects. We know that there's a very small incidence of direct sort of scarring and effect on the heart. Initially, we were worried it was higher, maybe up to 20%, but it looks like it's probably going to be in the 2 or maybe 3% range of patients who have some direct effect on the heart. But I agree with Dr. Laird that the long-term effects are really not known. And what will happen, say, 6 months from now or a year from now for those patients who did have a significant COVID infection?
Okay. I want to turn to the topic of student athletes. I know we've some articles in the last year or so pointing to some really tragic instances in the news. Dr. Laird, in your opinion, is sudden cardiac arrest a concern for families who have been through COVID, families who have had young athletes that have had COVID? Is that something that should be of concern?
Yeah, I definitely think it's beyond people's mind, because, we knowing that COVID-19 does have a predilection for heart tissue, and anybody can potentially get heart involvement even in mild infections, then you've got to be worried about sudden cardiac arrest. In young people, I think, though, at the end of the day, it's going to be by far and away the highest risk group are those patients that are going to have had the most severe infections. So this would be the subset of patients that get extremely sick, need to be hospitalized, and likewise the subset of those patients that develop what we call the multi-system inflammatory syndrome following COVID-19. And so most of these sicker patients do have, they may develop some element of myocarditis or inflammation of the heart muscle. That ultimately can lead to scarring of the heart muscle, and then that can be a trigger for sudden cardiac arrest. So definitely the sicker the patient is with COVID-19, I think the higher the caution and concern about sudden cardiac arrest going forward needs to be.
Sure. Are there any warning signs you would say be on the lookout for, say a child has had COVID in the last year?
Yeah, I think the biggest warning signs, during the acute infection would be how sick is the child. If you have you have a young person who has persistent fever for several days, really significant fatigue and exhaustion, and potentially any chest or heart-related symptoms like chest pain, et cetera. Your concern for myocarditis is going to be higher, so that would be a concerning sign or symptom. And then long-term, the things like chest pain, shortness of breath with exertion, palpitations with exertion, certainly any passing out or fainting in relation to exercise, those are going to be really concerning signs and symptoms that you would definitely want to get evaluated right away.
Okay. I would love to hear from both of you. What kind of testing are you doing in your office for patients who are exhibiting these symptoms?
Well, I can sort of say that it goes along with what Dr. Laird was saying about symptoms. So just like sort of any other patient who comes in, we would take a detailed history, and it's really not known how long you should wait after a COVID infection before resuming athletic activity. If you can pursue athletic activity, if you have a mild infection and otherwise feel well. I think those are things that we're still answering. And at least for our practice, the testing is usually symptom guided. It turns out that it's often very hard to detect heart effects from COVID by just an EKG or just an echocardiogram, especially if patients are asymptomatic. It almost requires an MRI to sort of see some of the scarring that can occur. So what we typically do is we base it on symptoms. If patients feel well, then we probably wouldn't embark on an elaborate testing strategy. Whereas if patients are having those kind of symptoms like palpitations, chest pain, shortness of breath, especially shortness of breath with activities. And for younger patients, I usually ask them about how they do compared to their peers. Like, can you keep up with them? Do you feel like you're kind of at your usual level of activity? And if patients have symptoms, then I would sort of pursue additional testing.
Yeah, and I would agree with everything Dr. Rawitzer just said. And then I'll add, the American Academy of Pediatrics for young people at least came out with guidelines in terms of returning to athletic activity. And they recommend that, a young person before they resume athletics should be asymptomatic for a minimum of 10 days and have at least a 10-day window from the time they had a positive test. After that 10-day period, they should be screened by their regular physician. If they had only a mild infection, their screening evaluation is unremarkable at that point, then they're cleared to go back to athletics. If they have had moderate symptoms or there's anything that pops up as a potential red flag on their screening evaluation with a regular physician, then they should be referred to a cardiologist. And at that point, that's where we're seeing younger patients usually getting an ECG at baseline on them and then considering further testing from there.
Okay, that's really fantastic information. Thank you. So we're going to wrap up in just a few minutes here, but before we actually filmed this interview, we asked our Living for Zachary family what questions they had about this topic. So I pulled just a few and wanted to get your perspective on these items. One question we received is, a young person who is already known to have a heart defect, are they at greater risk for developing issues after having COVID-19?
Yeah, so that's a really good question. I would say that most of the young people that we see, and our patient population is definitely a little different than Dr. Rawitzer's, but most of the young people that we see are children that have congenital heart defects or birth defects of the heart. And a lot of these are minor heart defects, and the children are living normal lives. They haven't had to have any procedures and such. And for this category of patients, I don't think there's any greater risk from developing issues from COVID-19 compared to the general population. We do have a smaller subset of patients that have really significant congenital heart defects that have classified as having chronic health issues, have had multiple surgeries, et cetera. This is the group that it's definitely at greater risk for developing issues and complications should they contract COVID-19. And the main issue is respiratory issues like pneumonia or the like. So we are being very careful with this group of patients in terms of doing our best to keep them safe and isolated and free of infection.
Great.
Yeah, I would say for adults, it's sort of the same thing. It depends on the severity of disease. In general, most of the adults with cardiovascular disease would fall into a high-risk group. And so we would encourage them to be very careful about all those healthy things: wash your hands, wear a mask, keep your distance, try to get the vaccine. Sort of easier things, but they definitely fall into a higher risk group. And even if it doesn't directly affect their heart, because they have sort of less cardiovascular reserve, they can have quite severe illness when they do get sick.
Sure. Is there, I believe you might have touched on this, but I just want to go back over it briefly. Is there a time frame after COVID-19 where risk to the heart may be elevated? Is that something we know at this point?
Yeah, so I would say for a young person at least, we would we would think about it in terms of myocarditis or inflammation of the heart muscle. And you can get myocarditis from lots of different types of viruses, but clearly it does seem to be more common in COVID-19. As I mentioned before, fortunately, the vast majority of young people are not showing heart involvement, but for those that do, then the risk is going to be the greatest in the first 3 to 6 months, because that's the time frame where the inflammation is calming down, the heart muscle is healing. And so that's for patients that clearly have had heart involvement with COVID-19, we're going to restrict those patients from any athletics or any heavy physical exertion during those first 3 to 6 months after they're recovering.
Fantastic. Well, I believe that those are all of my questions. This has been so informative. I know that we have a lot of people who are wondering about these types of things, especially with everything that's gone on over the last year. So this has been a really informative session. Thank you both for sharing your time with us. Your knowledge is just so critical at this point in time in our history. And so we're very grateful to you, and we're very grateful to our sponsor of this panel, Zoll LifeVest. So thank you both for joining me this morning.
Great. Thank you very much.
You're welcome. Thank you.